Hi, my name is Isabelle. I'm a trainee counselling psychologist pursuing my doctorate, and I work at private therapy clinic. In terms of my training and experience, I have a master's in psychology, and then I also have additional accreditation in counseling and therapeutic skills. I also am currently training to be a counseling psychologist, and I'm pursuing my doctorate. And in terms of experience, I've worked with a wide range of clients and people, including active listening at the listening place for people who are experiencing suicidal thoughts and ideation, working with women who are experiencing domestic violence and abuse through Womankind, and working with young people from minoritized backgrounds and Black backgrounds in Bristol through the organization Babasa. I've also worked with people who are experiencing any range of things from low self-esteem, anxiety, difficulties feeling motivated, feeling stuck, or who just want a space to talk and explore their feelings. In terms of me, I like to think very warm, collaborative, open. I'm going to meet you where you're at and work with you in a unique way as a therapist. So I don't believe in a one-size-fits-all approach. I use a lot of person-centered techniques as well as incorporating other modalities like CBT or potentially acceptance commitment therapy techniques to build something that really works for you. I think it's important we have a strong therapeutic relationship and that we get along really well and you feel safe with me. So that might be exploring in the first couple sessions what that feels like for you. And I do encourage you to shop around and talk to multiple people because who you work with is very important and unique to you. And it should feel comfortable and a space that you can really bring yourself to and open up in. I moved around a lot as a kid. I also have lived a lot of places as an adult. So I have a unique understanding of what it is to live in multiple places, cultures, backgrounds, and I will bring that to the therapy room and share that with you when and if appropriate. I also, someone who has a creative background. I worked in the media and broadcast industries for the past decade, as well as being a performer myself. So I understand the unique pressures that certain workplaces and environments put on us, as well as social media and the anxiety and frustrations that our increasingly modern world can cause. And I'm happy to work with you on that. And I also like to incorporate sometimes some drama therapy techniques and a little bit of creative expression and fun in our sessions. I think it's very important and beneficial to the healing process. As part of my training for my doctorate, I'm required to be in my own personal therapy. And I've also previously explored different modalities and different types of therapy for myself and my own personal development and growth. I'm also in supervision every fortnight. So I'm constantly evaluating, growing, learning, developing both my skill set, but also my empathy and my understanding of what it's like to sit in a room with somebody who is your therapist and to work with someone in that way. Because I know it can feel really daunting, intense, stressful to open yourself up in that way to another person. And that's okay. Like, that's part of the process. It's part of the journey. And I really believe that for me, being part of that and being on that journey with you is part of what makes me unique as a therapist and makes me understanding of what you might be experiencing and going through. And I've been in that position and I'm very, very happy to meet you where you're at. I think at some point or another in our lives, we're all vulnerable or susceptible to experiencing psychological difficulties or having a time where things just feel really, really tough. And that's part of humanity. It's very scary to go through that alone, but you are not alone because so many people, including myself, has had moments or difficult times in our lives. And it's extremely brave and resourceful to reach out and to ask for the help that you might be needing at that point. And I think that is an incredible thing to do. And it is something that I feel privileged to work with you on and to help you on your journey with. So when you come to see me, obviously we will meet one another, I will greet you, we'll talk about how you're feeling that day, what brought you to the space, and also some general background questions. Who are you? Where do you come from? Who is in your life at that time? Are there any social or environmental factors affecting you? I think all of these things come together to create the conditions that bring you to the therapy room or what you might be struggling with. So it's important that I address them with you. We might then also do a small assessment around any risks in your life or your feelings that you're experiencing immediately at that time. And then we will continue with sessions, and as I get to know you, we might make a more formulated plan around what your needs are. So are there areas that you really, really want to focus on at this time and that brought you to therapy? Or is there a certain skill or a certain ability you want to be able to build for yourself, such as resilience or reducing anxiety? So I'll work with you in both a person-centered way, meeting you where you're at, but also bring in some other techniques from CBT modalities, for instance, some skill practice, perhaps some mindfulness or meditation, and some other approaches that I will integrate into my practice with you. In terms of the approaches I use, I like to come to therapy from a real person-centered foundation. What do I mean by that? What do you mean person-centered? I mean that I want to meet you exactly where you're at in that time. I want to focus on what you're feeling, what you're experiencing, and I might reflect back to you what you're saying to get a better understanding of how I'm perceiving it, and you can correct me as we go. So it's quite a non-directive approach. It really gives you a space to feel heard and seen, which can feel really intimidating at first, but I'm not going to force you to talk about all your feelings at once. It will be honestly a conversation where I'm actively listening to you, I'm reflecting back what I'm hearing you say, and we tweak and adjust as we go. A lot of people have never had the space to really explore their feelings and thoughts in this way, so I find it can be extremely beneficial, especially when we live hectic, busy, and social lives. It's really a calming space for you to explore what's going on. Beyond that, I also might use some CBT, cognitive behavioral therapy approaches. And what I mean by this is there might be certain areas that you want to really work on, whether that's extreme anxiety or feeling overwhelmed in the moment, and I might employ some grounding techniques with you and some practical solutions that you can use when you're out and about in the world and experiencing these overwhelming thoughts and feelings. Lastly, because I'm in my training, there are lots of different modalities that I am constantly learning about and improving my practice with. So there might be some psychodynamic approaches that I use, some acceptance commitment therapy approaches that I use, and some other techniques that I choose to integrate into sessions. I will always ask for your input on something. I ask that you trust me to try something with me, and I look forward to working with you. I think it's really important to have interests and hobbies that help you unwind, relax, express yourself, especially in this busy modern working world. So that includes me. I'm not just a plank of wood, I'm a human. So some of the things that I really enjoy are, I love watching films, watching TV of all kinds. I love to go see plays and theater. I also express myself creatively a lot. So I perform and watch a lot of stand-up comedy around London. And I also think it's very important to exercise. So as a neurodivergent person, somebody with ADHD, I think that movement and getting your endorphins up in that way and moving, whether it's yoga, a walk, a run, a spin class, whatever floats your boat, for me, it helps ground me and keep me centered in the world. So those are just some of my interests and hobbies, and I'm excited to learn about yours. So if you are experiencing any mental health difficulties, or you're just curious to explore therapy and have a space to talk, contact Private Therapy Clinic, and I look forward to hopefully working with you sometime.